So in terms of advantages and disadvantages of the phakic IOLs, i.e. the ICL implant versus refractive lens exchange, with phakic IOLs what we're doing there is we're preserving the natural lens, so that's more appropriate for younger individuals. And the reason we do that is because the natural lens has exceptional zoom capability and can focus on objects here, here and here without any difficulty. Whereas the lens in our mid-40s becomes stiffer, that ability goes, and therefore in your mid-40 range it is more appropriate to have the refractive lens exchange where we put multifocal lenses in to give you distance intermediate and near. So that's very difficult to mimic the natural lens. So in younger patients it's the phakic IOL. Patients mid-40s onwards, typically we would offer refractive lens exchange for those patients who meet the necessary criteria. So in terms of recovery between the two procedures, it's actually quite similar. Both operations take about 15 to 20 minutes to do per eye, and the post-operative regime is very similar in both, so you're on drops for about 4 weeks afterwards. And the visual recovery is very similar, so within a few days you're seeing reasonably well and certainly well enough to function. So in terms of price difference between the ICL or phakic intraocular lenses and refractive lens exchange, actually there's not a lot of difference in price. The price is higher for the more complex prescriptions that we treat. So some patients, for example, will have a very high level of prescription as well as a large degree of astigmatism. So if you need a high level of astigmatism corrected, then you may need a more customized lens, which would add to the cost of the surgery.